Good afternoon, and welcome to another Facebook Live Lunch and Learn with the Center for African American Health. We invite you to take charge of your health this month by joining us next Saturday, February 12th, for the first phase of our I Am a Masterpiece Health Fair. CAA Health is offering free mammograms, prostate screenings, and COVID-19 vaccinations to the community. No appointment is necessary, and health insurance is not required. We would like to thank our sponsors, Colorado Trust, First Bank, Connect for Health, Cobb Institute, and Denver Health for supporting us in this endeavor. As we wait for a few more people to join, I'll introduce myself and tell you a little bit more about the center. My name is Deidre Johnson. I'm the CEO and Executive Director for the Center for African American Health. For those of you who may be unfamiliar with our work, we have been serving Metro Denver for 25 years. This is our 25th anniversary year. Very exciting. And our focus and commitment is on improving the health and well-being of the African American community. As we move through today's session, please feel free to type your questions in the chat and we'll address them if time permits. So understandably, the pandemic has caused a lot of people to limit the amount of time we spend in public places. As a result, routine trips to the doctor. Preventive care includes things like annual checkups, cancer screenings, the earlier you can detect an issue, the sooner you can address it. Joining me today are two of my favorite providers who have been longtime supporters of the Center for African American Health. Dr. Ozzy, who's a family medicine doctor, a past CAA Health board member, and Dr. Amy, a primary care physician at the University of Colorado Ludeman Family Center for Williams Health Research. Welcome, and thank you both.
Thanks for having us.
Absolutely, thank you.
So I'm excited to have you here today to discuss two of the screenings we're going to be providing next Saturday, mammograms and prostate exams. So Dr. Amy, we'll start with you. Please tell us more about your passion for healthcare and your connection to the Center for African American Health, which predates me.
I'm happy to do that, Deidre, thank you. I do have a passion for healthcare and for preventive health in particular. As a primary care physician, I really live by the mantra, an ounce of prevention is worth a pound of cure. I see things when they get out of the box and down the road, and it's a lot better if we can take care of things early on. So it's my pleasure to really be part of this. My connection to the Center for African American Health really launched in the spirit of also preventive healthcare to tailor the physical activity guidelines for Americans to the specific needs of Black women. We did this as part of a community engaged participatory research project with the Center for African American Health back in 2009, and discovered that our shared passion for preventive health between the Ludeman Center and the Center for African American Health meant that we should keep working together. And we've been partnering on the women's health screenings for the fair since that time.
Thank you. So when should women get a mammogram and what's the specific age?
Yeah, so age 40 is the classic start date for getting a mammogram for an average risk woman. If you have different risks, higher risk factors, it's of course always a good idea to talk with your primary care provider about what's right for you, but age 40 is the standard.
So there seems to be a lot of conflicting information about whether mammograms are effective. Why should women get a mammogram?
It's a great question, Deidre, and I think at least my read of the research doesn't give much of a conflicting story, but I would say that different guidelines and different organizations offer slightly different recommendations, and sometimes that's confusing, right? When one group says every 1 to 2 years, another group says every 1 year, you say, well, what's right? What we do know is that if you can catch breast cancer in time, just like most other cancers, if you catch it in time, you catch it early before it's had a chance to spread, you've got a much easier situation to treat. You can do things like just a simple surgery as opposed to having it spread to the point you need chemotherapy and so forth. When we diagnose breast cancers with a mammogram, it's usually very early stage, as long as women are getting their mammograms every 1 to 2 years. That means we don't have to worry about those other things like chemo. Early stage cancer is much more treatable. People survive much better than late stage cancer.
And so you mentioned 1 to 2 years, because my next question was how often should you get a mammogram? And um, women in my mom's side of the family, I've got aunts who are survivors. And so once I started, I was always annual. And then I had a new provider. And so now they're, oh, it's just every other year. So on the one hand, you listen to what your provider has you do. How often should you get a mammogram?
It's a really great question, Deidre. So the American Cancer Society says annual mammograms for women, at least until age 55. And then there's an option, depending on your family history, to potentially do every 2 years instead of every 1 year. So it really should be tailored to your history, how strongly breast cancer falls in your family. And again, depending the way you slice the data, it works fairly well to do annual or every 2 years, but I usually just recommend people go yearly.
Okay. Does the COVID-19 vaccine affect the results of a mammogram?
That's a really good question. And this is important for our time, right? We are in a time where people are getting vaccines. That's important. So what we know is that when you get a vaccine, any vaccine, whether it's the COVID-19 vaccine or another, you get the shot in your arm, and we're all familiar. Your arm gets sore, you get some swelling. You might notice you feel a little swelling in your underarm and in the armpit area on that side after the vaccine. That's normal because you charged up your immune system. You're getting the immune system going. The problem is what a mammogram is looking for is for areas of asymmetric swelling on one side and not the other. And the armpit is actually an area where breast tissue goes into. It goes all the way from the breast into the armpit. So there can be a false positive mammogram if you do the mammogram too close to the timing of the COVID-19 vaccine or another vaccine, because you still haven't had all of that inflammation have a chance to just naturally have your body take care of it. Accordingly, the recommendation is to wait 4 to 6 weeks after a vaccine before you have a mammogram, so long as it's not jeopardizing other care. Obviously follow the recommendations of your provider.
Okay, thank you. So now let's jump over to you, Dr. Oz. Please share your connection with the Center for African American Health and why you're passionate about healthcare.
So thank you, Deidre. I'm excited to be here and talk about prostate screening, prostate cancer screening. I've been involved with the Center for African American Health for maybe a couple of decades. Have worked as almost a physician advisor and have worked at the health fairs many of the years, and then was on the board most recently for probably 8 years, and then have just gone off. So love the work that you all do, and excited to be part of the future.
Thank you. And you've done a video for us, which we just came back, so you'll see that soon around COVID. So that'll be hot off the press.
Great.
So similar question for you. At what age should men start getting prostate exams?
So when we look at Black men and when they should get really looking at their prostate and looking for cancer, we normally tell them it's at 45. For everyone else, and or for anyone else who is not at high risk, it's 50. So for 45, for our community, it's critically important for them to start getting screened. If they have a family history and they're around that 40 to 45 age range, they should definitely talk to their provider about when they should be getting screened. Typically with most cancers, we'll look at if someone in the family has had a cancer that's been discovered, like prostate cancer, at an early age. We then want to make sure that we're testing people in the family 10 years before, as a rule, 10 years before that first person or that person was diagnosed. So lots of different ways to look at this, but certainly 45 is a good number to remember. And if there's a family history, it's talking to your clinician, your provider, your physician, whoever you see, some professional, to make sure that you are in that time frame and range to get screened.
Thank you. That's the first time I'd heard about the 10 years. That's good to know. Why is it so important to get a prostate screening?
Oh, as Dr. Amy said, the sooner we know that something is problematic, the better off we'll be later on. So when we can detect something small, get it out without a lot of issues, especially around the prostate, and identify it, then we have a much better chance and decreased risk of having bad things happen later on. So different cancers can metastasize or go from their original location to others. And so we always want to make sure that we're trying to catch these, screen these cancers such that we can get to them sooner rather than later.
And how often is the screening necessary?
Yeah, so as we look at the screening that we have for prostate cancer, there's a couple different screenings that we do. And then I'll answer your question about when we should do it. So the PSA, or prostate specific antigen, is a blood test that we'll have at our health fair that will look at where that number is. It's a protein created by the prostate. And when that protein goes up, and it goes up really fast, then we know something's going on that we have to really figure out and see whether or not it's cancer. Or if it's really high, then we've got to take the next step and get people to a urologist to discuss what the next steps are for them to get further screened around what their cancer, what is this cancer or what's going on. So we know as men's prostates, as men age, their prostates grow larger. When that grows larger, we know that the PSA will go up. So we're not worried about a slow increase in the PSA. What we're worried about is that zoom up that can really cause problems or indicate that something could be going on. So normally we'll have patients get these blood tests once a year so that we can track and see if it's going up. Sometimes if it goes up a little too fast, we'll say, can you come in another 6 months or even 3 months so that we can recheck to see, did it go down or is it tailing off and not going as fast? But we want to see how fast that's going up so we can make a decision on what we do with it. The other way that we check for prostate cancer, and it's become slightly less used, is the digital rectal exam. And that digital rectal exam is an exam where the examiner, the provider, puts on a glove on his or her hand and then detects pushes on through to the prostate through the anus. And so that digital rectal exam through the rectum, you press in and find out what's going on. Some people can feel nodules or irregularities in the prostate, which leads us to think about, is there something else going on? So both of them together are probably pretty good at detecting what's going on with if someone is at a higher risk for having prostate cancer. But we also know that just using the PSA is also a good way for us to see whether or not there are any issues. So when people, Deidre, when people come to our health fair, we want to make sure that when they get it this year, that they get it every year. And so whether or not it's through us or through someone else, that they're consistent with getting it every year so that we can see if it's going up too fast and we can hopefully intervene sooner rather than.
Thank you. Thank you. Good to monitor the change.
Yeah.
Has the COVID-19 vaccine affected the outcome of the PSA results in any way?
No, not that I've heard of. So I think on that front, it was much different than Dr. Amy talked about with breast cancer screening.
I have a few questions that have come in. The first one, some of our loved ones and friends are adverse to getting prevention screenings. This can be fear of results, costs, stigma. How is it best to approach these conversations?
Dr. Amy, would you like to start?
Sure, happy to. That's a tough one. That's I think I heard it phrased as some of our loved ones, so not, this person or individual themselves. When talking to others about any topic where they're hesitant, it's always important to remember they have their own agency, right? They get to decide what they're doing. We can come alongside them to hear what their concerns are, to try to understand what those are, to maybe even offer to go to the doctor with them and talk about it with the doctor to understand, in a discussion with the health professional, how does this play out? What makes sense for this person? But then then, you walk that line, right? You walk that tightrope of not nagging, not being overly pushy. So it's not easy when we feel like they're not taking charge of things. I heard that another piece of it, besides maybe just not trusting that it's effective, was fear of results or stigma. And again, those things can be helpful to have some conversations around. But Dr. Ozzie, I'd love to hear your perspective, how you handle this.
Yeah, no, I think you're right on with these. I think approaching those discussions from a place of love and concern is incredibly important. So they know where you're coming from. Obviously, they should, but reiterating that is always helpful. But then, as Dr. Amy and I have seen, who knows what button will be pushed such that in whatever conversations they have will lead them to then actually getting a screening. So whatever you think your role should be, is it someone who's the nagger? Is it someone who is the pest? Or is it someone who just brings it up periodically, puts reminders in the person's calendar or on their phone? It's whatever you think you can do to move the dial, because then that person may or may not hear something else from someone to then get them to do the screening. But the other piece is then to have a good conversation with the provider, so that when you talk to that provider, you can see what is the true issue. Is it a worry about results? Is it, if it is did someone in the family have results that were problematic and they had a bad experience? And so it's really trying to get in depth as to the root cause of why that person may be hesitant, as Dr. Amy was saying, and then being able to frame the conversation around why then you should move forward with the screening. Should that be a family member's job? No, that's our job. So that's why we want you to come in, because we've been trained to do that. We've seen this not a million times. We've literally seen this thousands of times, so that we are trained to make sure that we hopefully are able to move people in a better direction by listening to what they're saying, getting to the root cause of why they may be hesitant.
Another question. Any tools or suggestions on how to make sure you're getting screenings when recommended? There are people who have told me they forget to schedule their appointments regularly. I've done it myself.
You want to take that one first, Dr. Ozzie?
So one is knowing what screenings you need. And so that's really looking at, some people are able to look it up by themselves. So I am a woman who is 42 years old, and there are websites that can tell you what the typical screenings are at that point for you and what you should be looking at or looking for. I think Dr. Amy may have some resources on that. But we can also then, because most people have a cell phone, it's thinking about, can you put a reminder in your cell phone around this? Some doctor's offices or provider's offices, if you have a primary care doc, can then help you with reminders. So sometimes they'll be able to put in a reminder in their electronic medical record that goes out to you, or you can ask them to email you when it's time. So there's that piece, but then the piece around, using your phone and a calendar or a reminder system is probably really good. And then just making sure that you're capturing all of the preventive care screenings that we want you to do. It's either looking online, but then also looking online and hopefully talking to a professional about what's necessary for you in your specific circumstances. Dr. Amy, do you have any other thoughts?
I agree with everything Dr. Ozzie said. The only other pro tip some of my patients like and I like is that same thing as your well child visits for your kids. You just kind of do it around their birthday. Picking a day or a time of year that you like to do your annual and your preventive visit stuff, and then committing to that and putting reminders in, like Dr. Ozzie said.
Another question. Any words of encouragement for those struggling to stay on top of their preventive health checkups during this pandemic? Well,
yes, I hear you. I have I have reminder notes on my whiteboard at home, the family whiteboard, to get my kids' well child visits set up. And those reminders have been there for the last 6 weeks, and they're just still staring at me every day. So it's there's a lot going on right now. And we know that you have to deal with the tyranny of the urgent, but keep on, what you will want to do when you have a moment, when you don't have to have kids quarantining in your home or other various things that have been real challenges to trying to do this. So have some grace for yourself, but keep those reminders and keep it on your radar.
Yeah, that's exactly it. Don't be hard on yourself. It's all right. So when you feel comfortable, as Dr. Amy said, give yourself grace. When you feel comfortable and you are confident in going out in the pandemic, wherever we're at with our latest surge, as it's coming down now, it's thinking about, well, can I get some of those preventive care items that I have checkmarked off my list? So it's really not worrying about what happened in the past. The pandemic messed a lot of stuff up for a lot of people. So now it's thinking about, when do you feel safe? When do you feel comfortable? When do you feel confident about going out and getting some of those things done?
Thank you. And Dr. Amy, you had shared a resource with us that Eric's going to provide for folks. Can you tell us a little bit about what that is?
Yes, thanks for putting that in the chat, Eric. So the University of Colorado Cancer Center has put this together as a resource that shows on a map what are some opportunities for different types of cancer screening. There's a few different buttons to it, but one you'll note is the low cost or no cost screening. So just like it's very important for the Center for African American Health this next week on the 12th to have free mammograms for the public, there are opportunities to do that elsewhere throughout the year. So clicking on that no cost, low cost screenings button provides options for breast cancer screening, cervical cancer screening, colon cancer screening, a host of different screenings. And I would put your attention to the Women's Wellness Initiative and also the community health centers within that low cost, no cost screenings as particularly good options.
Thank you. So we're going to wrap up, but before we do, I'd just like to ask you both to share any advice you have for individuals who may be anxious about checking in on their health.
I'll start. I think, it's really good when you have anxiety to try to state for yourself and think about what is that anxiety, try to name it. We can feel just anxious, but if you can say for myself, what am I anxious about? Is it because my aunt had a terrible case of breast cancer, and what if, or I've seen this happen. And if you can name that fear then and talk to friends and family about it, talk to your primary care provider about it, we can help walk through things, because an ounce of prevention certainly is worth a pound of cure, and catching things early means we can walk that path with you, find what comes up and help root it out, help treat it much easier than if it's gotten we haven't discovered till later.
I think those are all great ideas, Amy. And sometimes it's looking on the internet, finding and looking for specifically good things about why you should be getting some success stories and trying to alleviate anxiety in that way. The internet can lead you to many different places, but there are certainly ways that you can use that to help you with some of the things that you may be cautious about or worried about. And certainly talking to others who have had a good experience. We wouldn't be recommending these preventive screenings if we didn't know that they save lives in the end. And we recommend them for everyone. So, most of this is really trying to make sure that you are knowledgeable about what's going on. You understand what procedure or what the outcomes could be, as well then as next steps, and whether or not you want to then talk further about what's going on with the procedure. Some people don't want to know. Some people want to just go in and have it done. Some people don't want to know what the next steps are. Some people want to hear every single detail about what's happening through the procedure and afterwards, and every issue that could come up. And so we can provide that. So a lot of this is trying to talk to your provider about it so that he or she can hopefully help you figure out where your worry is and calm that down. With most of our screenings, we don't see a lot. With some of them we do, and then we take those next steps, but we want to make sure that you're comfortable with the process. So a lot of this is education, and learning about what's going on with the preventive screening you're interested in or you're having anxiety about, and then hopefully getting more information that will end up making you feel more comfortable.
Thank you so much. And I love how you both talk about it's not a one size fits all, but do something. So we're out of time. I want to thank both doctors for joining us today. And for everyone joining us, please take charge of your health. If you or a friend or family member need a mammogram, prostate exam, or the COVID-19 vaccine, please join us next Saturday, the 12th, at our building at 3350 Hudson Street. This video will be available along with other information on the center's website at caahealth.org. Take care and be well.